This is the banded posterior ankle distraction. So you'll notice that I have a band anchored up here, okay? I'm gonna step out quite a bit, as much as I can with this band tension. So I want quite a bit of tension. I elevated my foot just a little bit. That way it's more of a downward pull. And the reason I want that is because I want this band to lay flat on my foot, okay? I don't want it to be up on my ankle or blocking that range of motion that I'm looking for. So I want it down flat on my foot where the band is staying below these ankle bones, so my medial and lateral malleolus, okay? And so even what you can do is take your hand and push that band down so that way it's not sliding up, because if I'm trying to move through that ankle joint, right, where my tibia and it comes into my foot, that's what I'm trying to achieve. I'm trying to achieve that dorsiflexion to get my shin to my foot. Okay, position here. So this is really good for any type of athletic position, squat mobility. If we have ankles that are locked up, this can be a good exercise for that. So let's get that band flat on the foot. Okay, you'll notice I have my shoes off so the band isn't getting blocked. Sometimes my shoe will block that, so I like to do this barefoot. So I'm gonna get that band nice and flat, and then what I'm gonna do, okay, is make sure I maintain a decent arch. I don't want my foot collapsing in. I also wanna make sure that my knee is tracking straight over top of my foot, maybe to the slightly to the outside. Because what happens is our knees, where we fault, right, is our knees want to collapse in and our foot wants to turn out. So we're trying to avoid that as much as possible by creating this joint range of motion. Okay, so I'm just going to drive my knee over top of my toe and then relax out of that. You'll feel a slight pinch if this is something that bothers you a little bit. So we're trying to create this gapping-like effect to create new range of motion. And then you'll want to train through that new range of motion to strengthen it after you do this mobility exercise. So you'll notice that I'm maintaining that nice arch, driving my knee out. Okay, I can hold this band down so it's not coming up and blocking where that range of motion is happening at that ankle joint. And make sure you work this on both sides, or if you've ever dealt with an ankle sprain before, maybe this would be a good one for you to try out if you're being limited on that side. Because a lot of times when we squat, all right, bilaterally, we may shift to one side or the other, and it may be because you're limited in that ankle range of motion. Give this a shot, or we'll actually be doing this a lot of times in our recovery or mobility days.